Jackson in the studio with me. And before the break, we were talking about funding in the area of, what was that we were talking about?
The health system.
The health system, and how that is, there's not enough funding there to bring both sides of the health system together. And I'm talking about, I call them the alternatives, and then I call them the doctors, because they can work together to support each other. When one's finished with a patient, then they can send them on, refer them on, but there's not the funding there to be able to do that. Is there a way that there can be funding to support both areas?
Yeah, look, there are different funding models that have been proposed. So, and this is getting a bit technical, but so we our health system technical relies very much on fee for service. So a GP gets a payment each time you go and see them.
Yes.
Which means that there is really no incentive to not see you, is one thing. And there's also no real incentive for that quality of care. So it's really just a, 10-minute consult, 5-minute consults, I'll bill it through.
Yep.
Now, we still get very good service, even though they're not necessarily the best incentives to have facing somebody in that scenario. You'd kind of want to have some incentives for good outcomes. And you'd also probably want to have some incentives for keeping people healthy. So there are other models that you can use, and overseas what they use, it's something called capitation-based payments. So that's really where, I know it's a big word. So if you think each of us has our own health profile, and from that our own risks of needing hospital care or health care.
Yeah.
And so what it would really do is say, okay, well, you have diabetes, for example, so you're going to be more expensive this year for your health care. It's going to be more expensive than if you don't have diabetes, because your health care needs going to be higher.
Yep.
And so what we will do is we will pay a payment that sort of factors in all the factors, and maybe your age is a factor, maybe your gender, lots of different factors, and say, okay, this is how much money we think you're going to cost in terms of healthcare, and we're going to give that budget to a healthcare provider. Now, that could be the GP, or what might work better in the Australian context is a regional body that might then go, okay, we're here, and you still get free healthcare, like it's not about taking away free healthcare, but we can then use that money for a physio, for a dietitian, but we can think about how that money gets used to make your health better. So it's not necessarily just going to the GP, it might be a broader set. So there's other ways of funding healthcare that create incentives and also fund that sort of broader suite of healthcare services.
Okay. So how do you know if you go to your GP and they need, once they've finished their side of things, need to refer you on to someone? Do they have a list of people that they can refer on to? Because I would never refer anyone on to anyone unless I knew what they did, how good they were at their job, because that comes back to that GP if they don't do a good job. So what's the referral rate like?
Well, yeah, I mean, that's what happens now. So generally speaking, when you go to your GP and maybe you need to see a physio, they might refer you to a physio, or a psychologist, they'll refer you to a psychologist, or a specialist, they'll refer you to a specialist. So that wouldn't necessarily change in such a system, but it would just ensure that the money, I guess, would be spent on keeping you healthy rather than just on providing a service, in some ways it's quite a minor change. But what does the evidence say? Okay, if you're a diabetic, what does the evidence say about the best model of care for you? And that would probably say it's a good idea for you to do some exercise, probably, to see a dietitian. Probably a dietitian is always very important for diabetics. And so let's look at how we fund all of that and how we manage all that care.
And that's a really important thing, but also it goes back to the patient too, because the patient has a responsibility to themselves. And if they don't take that responsibility and expect everybody else to take care of them, and they're not doing the right thing, what happens? They keep going back to the system. They keep getting told that they need to do this and need to do that, but they never do it. So they're sucking up the funds that somebody else really needs. How do you work and process that?
Yeah, look, it is difficult. So compliance with either medication or activity or diet-based issues are always an issue, and for certain members of the community, it can be harder to do those things. You know, and then we're talking about mental health, for example, before, and also education levels. So generally speaking, you know, people who maybe have lower levels of education will have lower levels of health literacy, so may not understand exactly what's being taught to them. So may need, you know, it may seem like something simple to some of us, like, well, you just do that because you were told to do that. But if you haven't fully understood what the doctor said and what that means and the benefits, that what, you know, you might not necessarily know exactly what you were meant to do, that can make it more difficult. And so that's where, you know, checking in, making sure, and that's sort of more, you know, some of the models that can work really well, and particularly older people can just forget, you know, to take medications, or is that some of those models where you maybe get a phone call or you get actively managed, and that's not for everybody. And I think that's the thing, the system probably needs to work better for different people's needs and where they are. Then you can get some better outcomes as well.
And I know people now can have patches when they have diabetes, which monitor them, and they can read that off their phone and do all sorts.
It's amazing.
All this sort of stuff that can happen these days is, you know, they're simplifying it for people instead of them pricking their finger and, you know, testing their blood and doing all that sort of stuff. I think, you know, there's research and everything going on, and research costs a lot of money. Research costs a lot of money in lots of areas, and there's lots of fundraising. People do, you know, there's all these charities to do fundraising and all that sort of stuff. But there's an expectation that government needs to provide more. Why?
Well, I don't know if government needs to spend more. I mean, in healthcare, one of the reasons we like there to be, you know, government and government involvement is it is found to be more efficient, effectively. So from a health economics perspective, there's obviously an equity concern. There is that, you know, we want everyone to be able to access healthcare. It's not something you want to think, I can't get cancer treatment because I can't afford it. Like, you know, there's a general, I think Australians, maybe not Americans, but Australians have a view that if you need it, you should be able to get healthcare. So that's one reason to have government funding. But studies also show, and again, America's a classic example, you know, much more private funding of healthcare, and they spend roughly twice as much as we do as a percentage of their economy on healthcare. So it's much more expensive. And the reason for that is health isn't what we call a perfect market. It's very difficult for us as consumers to know exactly what healthcare we need. You know, if we go to a doctor and they say you need this surgery, difficult to go, I don't think so. I mean, people do. But generally speaking, we could.
I don't think so.
But we don't have as much information. And so there's information, what we call asymmetry, very technical term, but doctors obviously know more than their patients, rightly so.
Well, hopefully.
Heavily educated. Yeah. But that means they have a lot of what we call market power. So they can charge a higher price, they can generate their own demand. So, you know,
specialists we're talking about here.
Specialists and GPs, you know, like the reality is it is a profession that is incredibly skilled, and they do need all that knowledge, and that's not a bad thing, but it does mean that this power imbalance and this information imbalance gets created, and so you can lead to over-servicing and higher prices, which is another reason to have government heavily involved.
So there's some sort of regulatory.
That's right, and the prices are set in an efficient way, and that the information, you know, the types of procedures that are offered are evidence-based, backed by the science, and it's not just, you know, we're seeing at the moment, maybe for your listeners, I shouldn't be making a thing about Brighton, but plastic surgery.
Go right ahead.
Which is a big thing, and you're seeing, you know, people who aren't properly qualified doing plastic surgery that, you know, it's terrible.
Scary.
Well, it is terrible, and it's ruining people's lives, and they're ending up in severe pain. It's all absolutely terrible. But again, you know, when you don't have that as consumer, as a patient, you don't have the information, so there's a lot of trust required in that relationship.
Yeah, and I think, you know, if you're going to go in and have plastic surgery done, I think you, as a consumer, need to do your research to make sure that you're going, because it's your responsibility at the end of the day. If you don't do your research and find out whether that plastic surgeon is capable or not of doing their job properly and seeing the results, you know, even asking some of their patients, you know, or seeing them so that you can see the results that they had. I mean, it's a responsibility we have as
But
consumers.
but it is something people maybe don't understand as well. Or, you know, we talk about, you know, I grew up, as you know, my dad was a doctor, and so I always understood that there's different quality. Right?
Mm.
So if you get referred to a specialist or you need to have an operation, you know, there is a variation in quality between specialists, between surgeons that can be quite significant. And I remember my uncle actually had anyway, might be listening, so it's okay. But he had prostate cancer, and so he had to have an operation for that. And he was going to go to see a specialist in Canberra, and it was, I think it was like a 1 in 5 chance of being fertile, you know, being impotent afterwards, right? That was his rate, which seemed pretty high. And I sort of went, you might want to look around, like they don't seem like the best odds. And Canberra, this guy probably only did 5 or 6 of these operations a year, small market. And so he was like, oh, okay. So he went to a guy in Sydney and the odds were flipped. So it was like a, you know, 4 in 5, like a, you know, 1 in 5 chance of a bad outcome rather than only a 1 in 5 chance of a good outcome. Because this guy did, you know, 10 times more operations a year. It was a bigger market. And
More
I was like,
experience.
well, thank you, because I had no idea that there'd be any difference. And it's like there's this huge, and so there is that. I don't know if people do understand that there is a very big difference. And so it is worthwhile, especially if you're having an operation and there is a chance of an adverse outcome, to look around and to
Do your research.
That's right.
And that's what's so important. And as you know, as consumers, we have that responsibility to ourselves to do the research, to find out the best place to go, the best physician, the best specialist, plastic surgeon, or whoever it might be, whether you're prepared to pay the money that they're going to charge you, because you know if they're the best, they're going to be charging you a lot more money. So
not necessarily. So that's the thing in healthcare. So that's the other thing. To
okay.
be is that people often it's because we can't judge as consumers what's good and what's not. People will actually often charge more to signal to you that it is high quality. And so that's also where you get these perverse outcomes. It might sound that as a consumer, you might be looking at 2 options and you go, oh, well, that's only $100 and that's $50, and I've got no other way of judging what's good or not. Oh, well, I want, this is an important operation for me, so I'm going to pay $100. But that might not mean that they're better. It might mean that they're just better at signaling, oh, this is how I signal to people that I'm high quality. I'll charge more, right? Like if I charge more, then people think I'm better. And so you do need to be careful about that as well. It's not necessarily the case that the higher price is the better.
Yeah. I just want to touch on the pharmaceutical companies.
Yeah, okay.
The pharmaceutical companies, and you know what they control in our health system.
Yeah. It's interesting. I was always quite sort of negative around pharma companies, and I think they get a pretty bad rap.
They get a pretty big bad rap. Yeah.
Look, it is interesting, but we have set up, the way in which we run our pharmaceutical industry is that we expect, and it is a lot of investment, so they have to invest a lot of money in drugs, and like to get a new drug onto the market costs around $2 billion. That's a lot of money. And rather than funding that through sort of public grants or research, we put it onto these companies to do that and to take the risk. And then they do tend to then want the reward at the other end.
Yeah.
And that can seem not, when people's health is at stake and someone's making that much money, it doesn't feel quite right. But that is the system we have set up. And so it's a difficult one. And I think overall, a lot of these, certainly the drugs that get sold in Australia or are available under the the pharmaceutical benefit scheme, so you can go and get subsidised.
The PBS.
They go through a very rigorous process of being safe, being cost effective, so that is, they're better than the alternative treatment and they provide value. So while they do tend to make a lot of money, and I think you have to be careful because there's definitely continues to be examples of bad practice that need to be called out.
Yeah.
Particularly if you look at opioids in the US, which is pretty shocking. Overall, you know, it's a system that has served us well, and I think, yeah, but it's difficult to see people making quite so much money in the private
sector. Yeah, and it's interesting, but yeah, okay. So what else in the health system do we need to know, Angela?
Very open-ended question.
Very open-ended
question.
No, as consumers, what do we need to be aware of? Because I keep on coming back to, we are responsible for our own health and well-being, and we expect those services out there to be good enough to help us when we can't do it ourselves. So, you know, are our expectations, some people's expectations are higher than others. There's a high demand out there for the medical services for so many people. And I always say prevention is better than cure. So there's a lot of education that needs to go on. A little bit, I suppose, too late for the older generation because they probably have the illnesses and things already and they need to deal with them. But what about the younger generation and the education to take responsibility for their own health and well-being and only use the system if it's really necessary?
Yeah, look, I mean, I think it, you know, and we know what the risk factors are. So obesity, so diet is important, exercise is important, smoking, increasing evidence of the harms of alcohol, and even, yeah, I know. We're doing the Prosecco festival, probably not the best thing for the health. So
little sips.
You know, all those sort of things do matter and do significantly increase your risk factors. But it's hard to completely eliminate the risk factors. I mean, in essence, you know, you
can't eliminate them.
You know, we all know, you know, very close friends who live incredibly healthy lives and do everything right, and then still get cancer, and still, you know, find that they have heart disease, or, you know, all of these things are genetic. So there's not a lot you can do. I think when you do become unwell, it is, you know, go to the doctor, and I think men in particular need this message is don't delay it. Like if you're, you know, particularly if there's any concern, it is better to go and get checked out and investigated and go early, because the earlier anything gets dealt with, the better.
The better, yeah.
And then, you know, if you are in a position of, you know, needing surgery, do look around about what people's stats are and what is high quality and what's low quality. You know, we are served by an amazing public hospital system, particularly in this state. We have some of the best hospitals with some of the best doctors. So if you're sick enough to get straight into a public system, I would say that would be my first choice.
And the nurses and, you know,
yeah,
are amazing.
Yeah, but if it's elective, you know, look around and make sure, you know, you get the best surgeon and take your health seriously, basically.
For what you need. Yeah. That's a good idea. Now we're going